So today's lecture is going to continue our talks about developmental delays and conditions that might affect a child's ability to be successful in the classroom, in their social lives, and of course through their development throughout the rest of their lives. We talked a little bit about autism last week. This week we're going to talk about a different deficit, and that's going to be attention deficit hyperactivity disorder, or ADHD. Okay, so many of you probably have heard of this before. It is, like I said, we are seeing a bigger prevalence of it in our field of practice. Okay, so it is something that we're seeing pretty regularly with children, school-age children, and even adults. You know, many adults who have gone undiagnosed with ADHD, or what we formerly knew as ADD, attention deficit disorder, has really affected their lives in some not so great ways. Okay, now there's some positive aspects to ADHD and ADD. First and foremost is of course the energy, right? People with ADD or ADHD might be able to start a lot of projects at the same time. Okay, they might be all over the map with getting things, but with that, we also see the negative side of things, which would be the inattentiveness, right, or the inability or difficulty completing those tasks or staying on focus, right? So while there are some positive aspects to it, there are some negative ones, and we're going to kind of really focus on those negative ones because those are really where we want to step in and provide some kind of intervention or realign that person's environments to match what their capabilities are. Okay, so I'm going to go ahead and share my screen with you, so you can take some notes. If you want to screenshot and see what I'm seeing, you're more than welcome to do that. Second here. Okay, so move this off the side. Got way too many screens, All right, so as I said, ADHD, which is known as attention deficit hyperactivity disorder. So I'm not going to say this every time. Again, it's like autism spectrum disorder. I'm not going to say it every time. We're just going to call this ADHD because that's what we know this as. Okay. So ADHD is a disorder that crops up somewhere in childhood, and it's something that the person will really have for the rest of their lives. Okay. And as the name kind of tells us here, ADHD is a disorder where the person struggles with their ability to pay attention. And they can also really be hyperactive and actually a bit impulsive too, which at the moment, we aren't entirely sure why ADHD happens, what the cause or what causes it. But we do know a few things that we've collected over the past few decades. And of course, it's been more and more prevalent as we delve more into some of these causes and reasons that we do know of. Okay, but we've collected a few clues along the way that are helping us paint a picture about what might be going on. And so we know that if a family member or someone who shares some of our DNA, if a family member has ADHD, like maybe a parent, well, then their child is going to have that. So we can really for certain say that there are some genetic reasons for that occurring. Okay, so family, especially parents. Okay, family members with the diagnosis will oftentimes, especially one. Okay, so for example, say if a parent has ADHD, and their child might actually be more likely to develop ADHD. And if both parents have ADHD, then that risk number goes way up, okay? Now, as I said, a lot of this has been undiagnosed over many decades. We didn't really start looking at this until probably around the 1990s, I would say. So many children, but prior to that, they were just treated as maybe mischievous or really active children, okay, which was kind of disservice because, again, as we looked at the ASD model, we were kind of seeing if children didn't fit that education model, then they were kind of pushed out, left behind, and that really affected their success later on in life, okay? But so that's really important to keep in mind. So just because two parents maybe don't have that ADHD diagnosis, you might be able to look at them and make that diagnosis yourself, or come to a conclusion that maybe they had it and it was just undiagnosed for some time. And that'll kind of lead you to whether or not the child may have it, okay? The other genetic factor that we know is gender, okay? As far as binary birth, so male and female, okay? We do know that boys are more likely than girls to develop ADHD. So both of these here are clues that suggest genetics play some sort of role in development of ADHD. But we're just not quite sure yet what the role is, and we've also found out that there are a few environmental factors, for example, like exposure and environment. Now, there are many factors. There could be several chemicals, but one of the ones we do know is that smoking during pregnancy and even smoking in the child's environment is a risk factor, okay? So that could be something that you want to educate. If any of you are in the medical field or counseling field, that could be something you want to let them know. So not the child smoking, but the parent smoking, that would increase the risk of ADHD, okay? So that's just an example of some environmental factors. Has anybody heard of any other environmental factors that might contribute to ADHD? Whether you know that it's true or not. Have you heard anything? Okay, nothing. Crickets. Man, I got a live class today. All right. One of the ones that I get with parents a lot is they think that eating too much sugar. Has anybody heard that? Has anybody heard that sugar might lead to ADHD, cause of ADHD? How about, you haven't heard that one? Okay. Well, I'll tell you what, maybe this group is a little bit better educated. But I've also heard that watching TV might be a cause for ADHD. Watching too much TV might cause that, right? These are actually misconceptions, okay? There's really no scientific backing whatsoever that says that too much TV or too much sugar can actually cause ADHD. So those are really myths, okay? But what we do know as far as neurological reasons, we do know that things going on in the brain of someone with ADHD, well, they've actually given us a clue as to what we're looking for as far as medication. We actually got that by trying different medications to treat ADHD that lead us to believe that certain neurotransmitters, okay? Basically, kids with ADHD, that they're given medicine that increases levels of certain chemicals are called neurotransmitters, specifically dopamine and norepinephrine, okay? So kind of just do this here. So I'm gonna put RX for prescriptions, okay? Prescriptions, we know that trigger an increase in dopamine. Now, dopamine, if you've taken my general psychology, or if you've taken another general psychology, you would know that that's your pleasure sensor. That's your pleasure chemical in your brain. that helps you with reward. Okay, it gives you certain types of rewards based on the activities that you're doing. Okay, so that's an important one for kind of your feel-good chemical. Norepinephrine is another one. Okay, norepinephrine, when we give people with ADHD these medications, they actually helps them focus and pay attention and can help reduce their hyperactivity and their impulsivity. So we think in the brain of somebody with ADHD, there's something going on with these dopamine and norepinephrine neurotransmitters within those systems, which is why the medications seem to be helping out. And we're still trying to figure out exactly what's going on with those, but it really gives us a good indication as to you know, how these certain things react in the brain. Okay, so I guess the takeaway from all these causes is we tend to think that it might just be psychological, right? And there might be some truth to that. And I can say with a certain with a degree of certainty that when I treat children or even adults with ADHD, there is certain amount of organization that you can work with them, get them into patterns and routines, similar to autism spectrum disorder, ASD, right? If we can not only have them successful in their environment, mold their environments to what their specific capabilities are, we can do that with ADHD as well. We can help them with organization. So there is a psychological component to it, but we can say with a degree of certainty that the causes are not purely psychological. It's more chemical, it's more genetic. So just to kind of give you some insight as to what that means when you're treating people with that, and not assuming that it's just you know, their inability or unwillingness or laziness. You know, I get that a lot. A lot of people think their kids are just lazy. They don't want to do the work, right? All right. So now, having trouble with attention and being hyperactive and impulsive, well, these are things that we really all struggle with from time to time, right? So you might be thinking, well, when we do encounter these these struggles, are they really a disorder? Okay, at what point are they considered ADHD and not just some normal variant in order for us to figure this out, right? So ADHD has a specific diagnostic criteria. Okay, in a book, you've heard me refer to it before. Does anybody remember the Bible for psychology and mental health? What do we use for diagnosis?
Is it the DSM-5?
Exactly. I heard a couple of you chime in there. Yeah, but the answer is correct. DSM-5, Diagnostic Statistical Manual of Mental Health for mental health disorders. DSM-5 is what we use. Now, the 5 stands for the 5th iteration, the 5th edition of it, which came out right around 2015. It was published, but this gives us really the specific criteria for what we need to look at with ADHD. Pretty much similar to any diagnostic criteria. If we're looking at depression, if we're looking at PTSD, if we're looking at autism spectrum disorder, anxiety, general anxiety, you name it. Anything you can think of that's considered a disorder, we get that from the DSM, okay? Which is kind of a medical look. Again, if you've taken any psychology courses, you would know that's how we look. We look at this from a medical standpoint, okay? So if we were able to take a look inside of this diagnostic manual here that we call the DSM, we open it up and we look up ADHD, and this is really what we would find. There are 2 main symptoms that we would see here under ADHD, okay? And I should really pop that. What I'll do is I'll write these down. So the 2 that we would see are inattentive type. And we would also see hyperactivity and impulsivity. I'm just gonna put hyperactive, I'm not gonna spell it all out, and impulsive type, okay? Now, the reason they have two of these is because they are two distinct clusters of symptoms, okay? So now for us to figure this out, we would have to look to see how many of these we can actually check. And they have like little checkbox for some of them, okay? Now, there are ways for us to really, we can use certain assessment tools. There are a lot of assessment tools out there that we can use to figure this out and really track as to whether there may be some ADHD components here based on how they answer the questions, right? But anyway, these are really the two clusters that we're going to look at today. So the DSM gives us some examples of how these symptoms can manifest, and it's these that we use to see if somebody has ADHD. So just to be totally clear, there's no single test that you can really do to diagnose ADHD in a child. Instead, there's just kind of a lot of discussion between parents and clinicians to see if these behavioral signs we just talked about are present, okay? So based on the children and how long they've been doing this. So for example, so let's look at some of these. And let me backtrack a little bit. The reason why I brought that up is talking to parents and maybe even educators is because we don't really get a whole clear picture on an individual just by them coming in for an assessment, okay? A lot of this has to be how do they respond in their home environment? How do they respond in their school environment? How do they respond socially, right? How is their communication method? So we really have to look at, does this happen across all settings, or is this just like a specific behavior with a specific person in a certain environment, okay? So for example, if I give you an example, we have little Billy. If Billy were maybe a little restless in class, like he's up and down and in and out of his seat, he's not really paying attention to the teacher, you know, he's having a hard time focusing, but he gets home and he's able to stay on task and on point. That would be an indication that it's probably more of an environmental, psychosocial situation as opposed to maybe more of a genetic, actual ADHD, okay? So inattentive type, back to this. So inattentive type, we would see careless mistakes. Okay, so asking little Billy to put his toys away, and he may start putting a couple of them away and then not do the rest, okay? And over time, it varies. Maybe he puts some of them away, maybe he puts all of them away, but we're going to see a lot of careless mistakes in details that we're asking him to do when we're giving him tasks. The other one is trouble focusing. Like I talked about earlier, if you give somebody a certain task or you give them a bunch of tasks, are they able to start up a bunch and stay on point and get them finished? That might be a problem if they can't do that, because that shows that they're having a little bit of difficulty focusing. The other one is not listening. So asking Billy to sit down in a seat, and he's too busy carried on in conversation to really pay attention to what you're saying. He may be locked in something else he's doing, and he's not able to focus on what you're telling him to do, not following instructions with that, which is the second one, or I'm sorry, the fourth one is difficulty following instructions. Okay, so getting a list of instructions and procedures is the child able to carry out and execute those tasks with relative ease, okay? Again, not finishing tasks. So maybe they are able to spin up a bunch of tasks and start new projects, but they're not able to finish them. Not finishing tasks. It's another one, okay? And then the last one we have for inattentive type of ADHD is easily sidetracked. Okay, so you kind of see the theme here, right? Sidetracked pretty easily. So I don't know if any of you, oh, what was the movie? Over the Hedge, Hammy. Did anybody watch Over the Hedge? Maybe not. It's been out for about I think like early 2000s or something like that. But they have the squirrel on there that he's just all over the map. Now that would probably be more hyperactivity, but always losing things, not listening. I can kind of see both of these overlap here, inattentive type and hyperactive and impulsive type. But anyway, so these are just some things that the DSM would look at to see. And another one, sidetracked, would maybe even losing items. Maybe they're losing their coat all the time at school, or losing their backpack. Um, just not being able to pay attention to whatever they have in front of them. Okay, so that's inattentive. Any questions, or anybody have anything to add that maybe they've seen with inattentive type?
I'll add something. I don't know how relevant it'll be, but there's somebody that I know that's ADHD, like, and she's in a professional position, and she'll make out like an agenda. And if she can't stay on task, she'll, well, for lack of a better term, she'll freak out if she can't stay like really focused and on task of what she's doing.
Yeah, yeah, absolutely. And there's a lot of truth to that. And that's really one of the coping strategies that we have for helping children stay on task, or people, even adults, stay on task with inattentive type of ADHD, because that becomes a problem. And I think many of us can probably relate to this a little bit. Maybe we procrastinate, or we get so busy we lose track of things. Trying to make lists, that's a great way to stay organized. So organization helps inattentive type a lot easier, right? Because it starts putting things into certain routines for them, so that they know. For example, I'm not saying that I had any diagnosis of ADHD, but I can certainly say that I get a little sidetracked sometimes, and I had a problem losing my car keys. Maybe some of you can relate to this. So what I did is I developed a strategy, a routine for me is to put the car keys. They're either, number one, in my pocket. There's a certain pouch in my bag that they go in, and I even put up hooks in my kitchen to where that those keys would be. So they are always in one of those three places. And whenever I have them in my hand, I make sure that I either put them in one of those three places, so that way they don't get lost. So those are just some strategies you can use with helping with the inattentive type of ADHD. Okay. So let's look at hyperactive and impulsive type. Okay, because these are a little bit harder to control, especially with children that have severe hyperactivity. Because what they tend to do is they have a surge of energy constantly going through them, and it's very difficult for them to really focus on what they're doing, right, or responding in inappropriate ways. So you'll see that, and usually you can pick this out, you can sniff this out almost immediately, not only with adults but with children as well, because they may be shifting in their seats a lot, they may be fidgeting. And actually, I'm going to write some of these down here right now. So fidgeting or squirming is really a telltale sign of hyperactive and impulsive type. Okay, so fidgeting or squirming. All right, so maybe they're moving around in their seats, maybe they're standing up and sitting down, maybe they're tapping their feet or tapping their leg. And again, many of us probably have these. I know when I get bored, I'm usually tapping my pen or clicking my pen or something like that, right? Doesn't necessarily meet the diagnostic criteria for ADHD, but it certainly could be a sign if some of these other things are present. I mentioned leaving the seat, right? Getting up and down, in and out of the seat, having a hard time staying focused that way. Leaving seat frequently. Another thing that might be lost my place here, would be inappropriate running and climbing. activity. I'm just going to say activity. All right. So climbing up and down on the table, for example, getting up and down on the couch or up on the top of the couch, or climbing through windows, constant, just climbing and stimulating their brains would be a sign of inappropriate activity. Okay. So that could be a symptom. Let's see, what else would we see here? So feeling restlessness. Again, just kind of looking at similar fidgeting and leaving the seat. Okay, so restlessness is one of the ones that are listed. Excessive talking. Now, what does that look like? Excessive talking. Maybe some of you have known people that have excessive talking, right? That this manifests when they can't really keep track of what thoughts are going through their head, so they're just kind of talking through everything, right? So they may they may just talk on and on and on about random stuff. We call it tangential thinking and tangential talking, because they don't really stay on point. They don't stay on task, and that goes back to being sidetracked a little easier. So you can kind of see where these overlap, right? So being sidetracked and excessive talking and tangential thought would be really overlap between the two, hyperactive and inattentive types. So another area we could look at is interrupting people when they're talking. Interruptions while talking. That's a big one. And maybe some of you have noticed that. They have a thought that's going through their head and they're a little too impatient to be able to wait for it. So they blurt it out. They interrupt no matter what who's talking or what they're talking about. Okay. So let's see what else we got here. And we also have not waiting for turns, right? Now you might see with children especially, and this kind of goes with interruptions, not waiting their turn. So if they're standing in line to either get a prize or sign up for something or whatever, yeah, they might get fidgety. They might get a little antsy and not willing to wait that out, right? So these are all really symptoms. And again, I do want to point out that all of these have to be persistent. If you remember what I said earlier, persistent means that persistent. Persistent means that it happens across all settings, okay, and it interferes with daily lives. I think I mentioned this with ASD. We look at I don't remember if I had mentioned this or not, but when we're looking at DSM diagnostic criteria, we're really looking at what I call the 3Ds. And you may want to remember this. If you've taken my course before, I hammer this a lot. So the 3Ds. Does anybody know what 3Ds for diagnostic criteria are? Anybody? Anybody? Okay. How about distress? So what do I mean by distress?
Like
When we're diagnosed, go ahead.
Oh, sorry. Like if they're uncomfortable in a situation, or they're struggling to figure out what's going on.
Right. So does the behavior or thought actually, so it could be either one of these two. So when we're looking at diagnostic criteria, we're looking at does the behavior or thought cause distress for that person? Are they physically getting anxious or getting activated because of that behavior or thought? Another way to look at distress is it causing distress for other people around them, right? Is it causing other people to get a little anxious about their behavior? The other one is, oh my gosh, left my brain. Deviant, that's what it is. Deviant behaviors and thoughts, okay? So deviant means it's different from what everybody else is doing, okay? So actually, I'm going to wait until my example before I do that. And the last one is dysfunction. And dysfunction, pretty much just as it states, is it affecting their quality of life, okay? So for example, you may have children that may represent something. Maybe they're making careless mistakes all the time. Maybe they're having a hard time focus. Maybe they're leaving their seat, right? We can check off some of these boxes, but does it cause dysfunction? Is it causing them to not do so well in school? Is it costing them the like distress in the home, right? Is it risking losing relationships, losing out on pay, or whatever? That would be a sign of dysfunction. I always like to use, and all of this is contextual, by the way. I always like to use the example of you maybe go to a church. If you go to church and you see a woman talking to her dead aunt, okay, is that really deviant or dysfunctional or distressing? It might not be, right? It might not be, because that's kind of the context in which you do those things. You talk to people you haven't spoken to in a while, right? So that's not really deviant. It's not really dysfunctional because it's not causing her to lose out on any relationships, and it's not really distressing to her. It's actually probably comforting to her, and it's not distressful to anybody else because that's the environment you do that. Now you see that same person on a bus talking to her dead aunt. Now we can probably look at, is that deviant? Probably not the environment you normally do that in. Is it dysfunctional? Probably, because it might be affecting her relationships if she's doing that all the time. And is it distressing? Absolutely, if it's making people on the bus uncomfortable, right? So those are really the 3 Ds that we look at when we're making these. So again, when we relate that to children and their development, if they are showing signs of these, those are the questions we're going to answer. Is it causing distress, deviant? Is it deviant behavior? Is it distressing? Is it dysfunctional? And if the answer is yes to all 3 of them, then we can really look at whether or not we're going to classify them and give them a formal diagnosis. Okay, so these are really the variants that we saw with ADHD for someone. So for someone with ADHD, once they've been diagnosed, there are a few things that we can do to help treat these symptoms. And the 2 main things that we would usually do to treat ADHD is look at medication, right? I'll put treatment up here. Now, in my professional experience, I have encountered a lot of parents, a lot of caregivers that are really anti medication, okay? And I'm kind of on the fence. I'm not a pusher of drugs. I don't prescribe medications. I'm not a prescribing doctor. But again, when we go back to those 3 Ds, is it causing dysfunction? Is there something that we can do right now to help with to alleviate their symptoms and get them back on track for whatever they need to do? I think the best example is sleep. Let's say we have somebody that's holding a full-time job and they have an unusual amount of stress that they've encountered in their day, and either in their job or in their lives or whatever, and they are experiencing a lack of sleep. Many of us have probably encountered a lack of sleep before, right? It's uncomfortable. It's not great. And it's pretty normal when we're enduring a lot of stress. Now, if we're going on 6 months and having a hard time sleeping, things are going to start to be affected. We're going to be more irritable, which is going to affect our relationships. It may affect our work environment, right? If we're cranky to our bosses, or even worse, even customers that we're dealing with, that might be a problem. If we're so tired that we're oversleeping in the morning, having a hard time getting to sleep and oversleep in the morning, that's a dysregulation of a sleep pattern that could affect their work performance, that could affect their job, right? So in those cases, we may want to consider getting them medication to help them alleviate those symptoms so it doesn't make their condition worse, if that makes sense. Same way with ADHD. We do know it's a chemical imbalance. We do know that that there are certain skills that we can help them with. And I'll get to that here in just a minute with behavioral therapy. But for the meantime, until we can transfer those skills, we kind of need to get them leveled off to where we can see kind of a record light going on their head so that they can acquire those skills. Okay. So yeah, the medication is one. The second one is behavioral therapy, like I mentioned before. Okay. So let's look at really both of these. With the medication, there are two types that we use to treat ADHD. And we can actually break these into two types, break them down into stimulants and, oops, and non-stimulants. All right. So now you might be thinking, why would we give somebody with ADHD a stimulant? I mean, that sounds like the last thing you really want to do. That's the last thing that they need, right? Well, it turns out that these stimulants actually increase the levels of dopamine and norepinephrine, right? So increase dopamine and increase norepinephrine. And we do that for these transmitters, these neurotransmitters in the brain that seem to be lacking in somebody with ADHD. So these stimulant medications are what we usually turn to first when treating somebody with ADHD. And that's because these stimulant medications actually start working pretty quickly. And they also have a really long track record of being safe and effective for people with ADHD. But sometimes, Olivia, did you have something to add there? I just accidentally moved, unmuted. Okay. Where was I? But these stimulants can sometimes, they can have unwanted side effects, or maybe a person has another disorder or condition that these stimulants can kind of interfere with. So if stimulants aren't an option, maybe for one of these reasons, then we might turn to non-stimulant medication to treat ADHD. And we call these, when we say these non-stimulants, we're talking about really general group of medication that we would use to treat ADHD that is not targeting norepinephrine or dopamine or norepinephrine. All right. So an example would be like a certain antidepressant that can be really helpful for treating ADHD and is classified under a non-stimulant category. Now, if we move on, well, okay. So like antidepressant would be an example. All right, so looking at behavioral therapy, the goal there is to create an environment that allows somebody with ADHD to function their best. So this might mean making sure that things are really organized. So we would look at maybe organization, creating a schedule for them, or organization, creating routines. Now, one of the ways I like to do this with treating patients or clients that have ADHD is giving them cues, maybe giving them checklists that they can use to follow directions. Like if they're inattentive, you can give them checklists to help them, like Olivia had mentioned, having certain reminders, right? But that will help them with staying on point, right? The other thing is that we would use is to maybe decrease distractions. Now, the best way I like to illustrate this is say that you're working on a paper. Maybe you have a term paper that's due at the end of the semester, and you've got kids running around. You've got, maybe you're in inner city, so you hear a lot of sirens and stuff like that. Those things make it very hard to focus. Well, somebody with ADHD, like either inattentive or hyperactive type, might have a hard time focusing, because that's what regular life seems like. That it seems like they have all these distractions, all these things going on in the background. So for somebody with ADHD, if we can limit, like not having TV on the background when a child is doing homework, that can reduce some of the choices they're making with getting distracted, and that can also help with giving the child two different options. Like if they want to wear something to school, giving them only two options as opposed to giving them an entire closet. So really tailoring their environment to what is going to make them a little bit more successful. But those are just a few examples of what we can do to do that. So it's actually not uncommon for people with ADHD to also have other disorders or conditions on top of their ADHD. And that might need to be treated as well. So things like depression or learning disabilities, and these are sometimes we have oppositional defiant disorder, right? That's closely related to hyperactivity and impulsivity, but usually that's the opposite of they're doing the opposite of what somebody is telling them to do. So for example, a child with ODD, oppositional defiant disorder, is really disobedient towards authority figures such as teachers or parents or something, right? So those are things to keep in mind with ADHD, is they may have other conditions on top of that really need to be treated. And what I found, interestingly enough, through my practice, is adults that come that have maybe been undiagnosed with ADHD usually have signs of anxiety or depression, right? Social anxiety, right? They are realizing that they're dysfunctional in some way, and it's causing distress, and prolonged distress, we know, leads to learned helplessness and depression, right? So anyway, what are your thoughts on learning disabilities? I think that was the other thing I wanted to point out. Learning disabilities can come from ADHD. Why is that? Does anybody have a guess as to why learning disabilities might come out of ADHD? Am I still on? Can you still hear me? Can I get a sound check at least?
Hello, I can hear you.
Okay, you can hear me. Okay. Just making sure, and make sure everybody's still alert there. So can anybody take a guess as to why learning disabilities might come out of ADHD?
If you can't focus, you can't retain anything or like learn.
Right. So if a child, especially has inattentive type, is unable to read a book, for example, stay focused on a book, they may not learn how to gain skills for reading comprehension or even reading itself, right? So that may be a problem later on in life. If they are able to somehow bypass and get through by the skin of their teeth through whatever tasks they need to do in first and second grade, but yet they get to fifth or sixth grade and learn, and the teachers find out that they don't have reading comprehension skills, that could be a problem, right? We could really classify that as a learning disability. So all things to watch out for ADHD. Okay. Any thoughts? Does anybody have anything that they would like to add, or any questions that they have about ADHD, or any maybe even myths that you heard about it?
Yeah.
Anything at all?
Yeah, I have one question, please. Can ADHD symptoms change with age? Like, is the same as in child and in adult symptoms?
Can they change with age? Yes, yeah, they can. They can either get better, or they can get worse. And the reason being, if we go back to our original explanation, is the chemical imbalance. Like if for whatever reason something either lowers their dopamine levels or lowers their norepinephrine levels, we could see lack of focus, and that could happen with many conditions. It happens with depression. People with depression might display symptoms of forgetfulness and inattentiveness, right?
Yeah.
Easily sidetracked. So we can see those changing with adults. Likewise, or opposite to that, we can also see those conditions get better, and that might be without medication. And that might be through the behavioral therapy that we talked about. Either parents can teach those skills, or educators can teach those skills, or maybe even a behavioral therapist could teach those skills if it's that severe without the use of medication. So they may still have reduced dopamine and reduced norepinephrine, but they've compensated with some skills like I talked about earlier, just creating routines, or creating certain procedures or something, checklists to do. So if we get the child, or get the person acclimated to making these changes and adapting to their environment, it goes a lot better for them, and
Okay.
we see those symptoms decrease. Okay.
Okay, thank you.
Any other questions? Anybody else have anything to add? All right. Well, if nothing else, I thank you for your attention today. I'm going to stop recording here.